Again, the reason for this rally press conference today is to emphasize the fact that we are running ads throughout the state and in certain states in which we're trying to get the senators to pay attention to what it is we have to say. That really is our message. I know Barack was on, President Obama was on TV at 11, I believe it was today, or 10:30, talking about health care reform, and the Finance Committee has been talking about it for the last 2 or 3 days. We really are moving ahead, and we have to continue with a lot of support from the unions, from the people, and just get out there and tell everybody to get change happening and get change happening quick. I'm going to introduce you to Bob Wright. A lot of people know him as Move On Bob. He's been with us with me working now for probably 3 or 4 years, and he's going to just give us a couple of words, and I want to thank everyone for coming here.
All right, well, the single payer movement is moving right along. Doctors, some people say, oh, the doctors are opposed to it because it would interfere with their practice. That can't be farther from the truth. I was listening to Democracy Now! On the way over. It's a program that's on WCLH 90.7 FM. It runs from 10 a.m. to 11 a.m. news you won't get on Fox, CNN, or ABC. And on that show, they were interviewing doctors who were doing civil disobedience and were arrested for protesting our current health care system and advocating a switch to single payer. Single payer works in other countries of the world. Norway is a good example of where single payer is working. I'm an engineer, and I look at things, does it work or doesn't work? Our current system does not work. It is broken. It is time to scrap it and replace it with single payer. If we can't go that, at least as a minimum require a standard that the insurance companies must follow, a standard that everybody follows. Forms are identical, so the doctors don't have to deal with a different form for each insurance company. They can have just one form for whatever insurance company. That would be a compromise. Single payer would be the best, but at least if not, standardize it where everybody gets coverage. And that's about all I have to say for now, and thank you.
Okay, thank you everyone for coming. Is there anybody else that has an opinion to express that I didn't get to? Like I said, we're here for Healthcare for America Now. We do have our ads running on television, and we are very concerned about Senator Specter. We want to sit down and we want to talk with him, and we want him to have an open mind to discuss these issues. Healthcare is important to all Americans, whether you're paying for it or you need to get it. Everybody deserves healthcare. Everyone should have it. This is an important issue with the unions, and we need to go forward. We need to march together strongly. Help us get more people out. Help us get more people involved. We will get this job done this year. I promise that. Okay, thank you very much.